Dr. Prada, let's talk a little bit about liposuction. I guess the big question everybody wants to know is how much fat can you remove with liposuction?
I don't think there's a limit. I think everybody's a little bit different. You have to base it a lot on what your starting weight is. I think the key is to make sure you're performing the liposuction in a surgical center where we're monitoring the fluids that are going in and monitoring the fluids that are going out. But in some cases, I've removed 12 pounds off of somebody. In other cases, you remove maybe 2 pounds. 2 pounds in a smaller patient may look actually more impressive than 12 pounds on somebody else. So really, I don't usually base it on how much I'm taking out. It's basically fine-tuning, contouring the body to make sure that they look their best.
So who is a good candidate for liposuction?
Liposuction is really good for patients who have obviously excess fat in weak areas. Weak areas are typically going to be hips, thighs, abdomen, arms, those areas. And you also want to prevent skin on top of the areas that you're liposuction from becoming too loose. So in those cases, sometimes you may want to perform some other surgery, whether it's an abdominoplasty or a brachioplasty if it's necessary, which is an arm procedure. But if the skin on top of the areas of liposuction is pretty taut, has good elasticity, those patients are excellent candidates.
So where all can you do liposuction on the body?
Really, you can almost do it anywhere. I mean, you can do it from your face, jowls, neck, arms, back, breasts, abdomen, thighs. The areas I refrain usually from liposuctioning too much or doing very much at all is below the knee. Those are areas that tend to swell very much. You tend to have higher complications from doing that. So I try to prevent going below the knee if at all possible.
So you talk about you can do liposuction in all these areas. How big is that incision and where do you put it?
The incision's usually no longer than about 1 centimeter, which is about a stab incision. So usually those blend away pretty well. We try to hide those in areas or creases which usually aren't noticeable. In some cases it's very hard to do that, but in most cases the incision is pretty small and pretty well hidden.
And what's a different type of liposuctions that are available?
There's a lot of different liposuctions now. I think the time-tested liposuction, which has been around for almost half a decade, is standard liposuction. What I do a lot of is called power-assisted liposuction, and that's essentially a machine that rotates back and forth 3,000 revolutions a minute to suction out the fat that's in the body. There's laser liposuction, which a lot of people ask about, in which case a very, very small laser is used to heat the fat cell and dissolve it. The negative or the drawback to that is you can't take out very large volumes with that, and that's one of the reasons why I don't often use it. It's not very effective. And then there's ultrasonic, which is where you use sound waves to disrupt the cell and break down the cell and suction it out. Again, I go back to the suction assisted as the time-tested form of liposuction because once it's out usually for good.
Is one procedure more painful than the others? Is the technique better? Why do you pick the power assisted as one that you use the most?
I think it's the most effective at getting the fat out and getting high volumes of fat out. I think the laser liposuction, all the other techniques that are out there are good for small areas, and of course the less you take out, the less pain you're going to have. So a lot of these areas that are promoting laser liposuction or minimally invasive liposuction, whatever it is, are promoting it with very little pain, and that may be true because they're not taking out as much.
Interesting. So speaking of pain, discomfort, what is the recovery time like?
I find it's usually about a long weekend. If you have your procedure on a Wednesday, by Monday most patients are going to be back to work. I do have them wear a compression garment underneath their clothing for about 6 weeks. That just helps get all the swelling out. It's very thin, elastic, so it's easy to hide. But if you do very large volume liposuctions on patients, it may require up to about a week or so just to get get yourself back into full form.
So here, is bruising fairly common with this procedure?
You're going to get a degree of bruising. Again, the more you take out, the more aggressive you are, the more bruising you have. Bruising doesn't necessarily mean it's a bad thing. Again, I find in most cases the patients I take the most amount of fat out have the greater degree of bruising. If I take a very small area of fat out, maybe in the neck, they may have no bruising, but I also didn't remove very much.
And most people have seen liposuction performed on TV, you know, whatever channel that they like to watch. And it looks, you know, like they're beating the patient up. It looks pretty, you know, I guess tough on the patient. What is the pain level?
Well, it's important for the patients to know that the original technique, where the surgeon actually had to go back and forth to get the fat out, has been replaced mostly by what I was saying is the power-assisted technique. I kind of equated to trimming a hedge with a power electric cutter versus using your hand. The electric cutter can do it very efficiently, very smoothly, and again, that's the technique I like to use. Pain is going to be variable. Some patients have you know, more pain than others. I find, again, it just comes down to how much you take out, but I find liposuction is a procedure that most patients tolerate very well.
So let's say someone has liposuction done, hips, stomach area. Will they lose, you know, go down pant size, like for example, like with a tummy tuck? Or will they just, what changes will they see?
Yeah, they should see an improvement in the size of their pants in terms of them being able to wear a pant size that is smaller. It's going to come down again to what you start with. If you take out 5 pounds of fat versus a very thin patient where I may be just liposuction the lateral thigh and removing less. In that patient's case, she may be more interested solely in how she looks in a bathing suit and not requiring a lot of fat to come out. A patient who has a little bit more weight, those are patients who may be more concerned with pant sizing, how they look in clothing, you know, that, and in those cases you may go down 4 or 5 pant sizes.
Now, does the fat come back after liposuction?
Well, if you're going to gain weight, fat is going to come back somewhere. You have a finite amount of fat cells, so it doesn't usually go back to the areas that you've had the fat removed. But if somebody gains weight, your body's going to have to put it into other areas. This is going to be a lifestyle change. If you go through liposuction, it's very important that you change your habits, exercise more, eat right to try to maintain the weight similar to what you started with prior to the procedure.
So do people still need to work out after surgery?
I encourage it. I think everybody should work out. I think it's important, particularly as we get older and our metabolism slow down, to burn more calories. The older you get, the slower the metabolism is, the more apt you are to gain weight. It's in that patient population that I'm usually really insisting that you do exercise more regularly and eat right. If you need to, you can find a trainer or a dietitian to work with you. But liposuction alone is not the solution for weight gain issues.
Okay. What about a woman who, you know, had a couple of children, she's back to her ideal weight, but she has just that little pooch area, that we call it, in her stomach. Can liposuction get rid of that?
If you find that there's not a lot of excess skin and not a lot of laxity to the abdominal musculature, then liposuction is very good for that. Unfortunately, in most cases, if patients have had 2 children or more, you find there's a degree of laxity of skin and or laxity of the muscles, and it's in those patients that a more aggressive technique such as an abdominoplasty would be necessary.
So how far out after, you know, surgery do patients really finally see that final result, all the swelling, bruising completely gone?
Well, I think it's probably about 3 to 4 months out. It takes quite a bit of time. I think there's a rapid loss in swelling within the first 6 weeks, where you'll probably lose 80% of your swelling. But the final 20% is usually going to be closer to the 3 to 4 month mark.
And what do patients tell you when they come in at that point? How does it make a difference?
I think most patients are again, very happy with the way it turns out. They have to, all right, start that again.
Okay.
I think for patients who are a little bit heavier to start, they're very happy because their pants fit better. I think for patients who are thin and are ready to hit the beach or ready to put on the bathing suits, those patients are just excited because the areas that they used to want to hide are areas now that they feel like they want to show off.
Great.